I'm Ed Dudley with We Are Connected, and we're coming at you with another connected conversation. I am excited today to have my personal physician, Dr. Oscar Cornelio, join us today. Thanks for joining us today, Doc. Really
It's a
appreciate
pleasure,
it.
Ed. Thank you. Thank you so much for inviting. It's great.
Yeah, so what we really want to do is just have a conversation and just talk about what's going on with COVID. There's a lot of information out there with COVID-19, a lot of misinformation, but we really wanted to just hear from you that's in the medical profession, what's going on as it really relates to the minority community, because we have been disproportionately affected by COVID-19, and really just want to open up the platform for you to talk a little bit from the medical side as to what's going on and share some information. And I'm sure we'll have some questions from everyone afterwards. So, Doc, I'll turn it over to you, and feel free to enlighten us.
No, it is. Thank you again, Ed, for inviting me to talk about this important topic. Now, I think when something really critical happens at the kind of global level, not just national, but at the global level, you can see more clearly the deficiencies in our health systems, in our life, like a day to day, as and put us in a reflection mode about what is going on right now. Definitely existed before the pandemic, but now is getting more marked. That disadvantages, the disparities, the inequalities, not just in health, but it's in general terms, in the quality of life of people. So this is so many things to talk about. Honestly, I'm gonna start saying, and I'm just gonna take this as a conversation between friends. This is gonna be like having a cup of coffee and then talking about this. That we have been seeing everything, how the virus and the pandemic has been developing over the last few months, and obviously a lot of information on the web. There's a lot of information and a lot of misinformation as well. I start saying this, what we see now is what was happening before the pandemic. Let's go to the point, disparities in health. And I know most of the people who are following now are kind of understand most of the terms, like disparities, inequalities, racial inequalities, all that stuff in between. I'm gonna try to kind of, for those who are not into the healthcare arena, I just want to try to explain briefly what is this about. So obviously, when we talk about health from the public health standpoint, we want to make sure that the health of a population depends on the health of each individual. Let's just gonna start there, because we're gonna end up on the same point. My health as a city, as a state, as a country, is going to depend on the health of each one of the individuals. In any given place, you have people who are more vulnerable than others. What made people more vulnerable to others could be so many different, barriers. One is language, for sure, cultural adaptation, socioeconomic status, just living conditions, job security. So all those things that we call this in public health, we call it the social determinants of health. So just to remind, health is not only the absence of disease. When we talk about healthy, being healthy, it's just not only not taking any medication. So, I'm feeling good, I'm healthy. It's a broader concept. It's a way bigger concept than just that. So when we talk about health, is any condition that make you have a productive life, okay? And then there's so many factors that can make somebody to have a productive life. We're talking about, again, food security. We're talking about, good housing conditions. We're talking about socioeconomic status. We're talking about communities. It's what you do, Ed, here, is that we always talk about this, is how important it is to build the network, the relationships into the communities, because it's important part of health. You don't need to be a doctor to be having a health impact. From wherever you are working, whatever you're advocating for, you can always make an impact on health. And that is, I think we need to understand, we can focus on numbers, we can focus on the disease, we can focus on how the virus works, and then how, you know, all the systemic damage that happened to people or going to the ICU or ventilators. We can spend hours on that. But if we don't understand to begin with that what is going to be happening to the vulnerable populations is going to affect the rest of the people, we're going to be lost on this. Important, again, that we pay attention to helping or addressing disparities in health. Disparities in health are differing inequalities for different reasons, as we already spoke a little bit about. Cultural differences, just being afraid to be into a doctor, having, you know, lack of access to health, basic health services. It actually is going to be as important to promote health and to be kind of what we call preventive medicine, to be in good shape. Now, when the pandemic like this happens, you can see clearly how we pay attention to that, how not paying attention to these minorities can affect the rest of the population as a whole. To put some numbers out there, and we are all aware that during this pandemic, what we're seeing is that disparities on health, you know, to an exponential level, disparities on health, inequalities in health to get kind of maximized, so everybody can be aware. We need to create awareness of the situation going on right now. I'm gonna try not to talk about that, you know, biochemistry or pharmacology of the virus, because there is a lot of information out there. I know everybody's like up here, you know, including myself. It's important information, but let's gonna keep the big picture in mind. When we're talking about disparities in health and not helping vulnerable communities, we see what happened 2 or 3 months ago in Georgia. 70% of people in the hospitals, African American, you know, talking about Black people, heavily affected in the hospital. Let's go to the local level here in North Carolina. North Carolina, Hispanic, we represent less than 10% of the population in the state. It's about 9.3%. But we make, Hispanic, we make about 45 to 46% of the COVID positive cases. I'm talking about North Carolina. Then you ask this question, how a population that is less than 10% in the state can have almost 50% of the cases? People asking, and I have many patients asking me these questions, what happened with Hispanic? You guys are getting infected so easily. And then I answer back to these people, it's like, why do you think that's happening? Again, this is a conversation. Let me ask you this question. Let me ask you who are following us this same question. How can a small percentage of the population can have so many infected cases? Why 70% of people in Georgia were African Americans, you know, in the hospital? Why the death rate of Black people in North Carolina is actually almost 3 times the one in, you know, white? Why is this happening? Why we see, I mean, when you ask this question is why? And I think that is number one. We have to create awareness of this is something that is, you know, is worrisome. This is something that no matter how many medications, we need to work on the vaccine for sure. We need to work on other aspects. But if you miss, again, if you miss the whole point about serving everybody in your community, especially the vulnerable communities, because those vulnerable communities, talking specifically about, you know, Black communities, Hispanic communities, those has been hitting hard. Why do you think is that happening? Let's make some common sense. How many people, how many Hispanics who probably work in construction, how many of them can you tell them you can work from home? It's a joke. How many of them can you ask them, you know, you gotta self-isolate? I mean, they live in families, they live in big families, you know, we live in big groups. How difficult is to just do this self-isolation if, you know, they are together, yeah, 2 or 3 families, you know, co-generational in one house? How can you tell, essential care workers? Who are the majority of essential healthcare workers? I'm not only saying healthcare, essential workers, minorities. Thank you. How can you ask these people to stay at home and work from home? I mean, they need to work. They need to work every single day. They live day by day. So not only that, how can you understand that dynamics of this socioeconomic situation? How can you put that into consideration to have a better idea about the whole pandemic? Ask all these questions, because we don't need to have the answers right now. I mean, there's so many things that we can do. There is so many things that we can be talking, we can be, public riots, we can be, screaming outside, and then, which is okay, which is important. Don't get me wrong. We need to raise our voices. But now more than ever, we need to create awareness. We need to create awareness that these disparities in health affecting vulnerable communities are affecting all of us. Again, is the initial concept, is a very simple concept in public health. The health of the community, it depends on the health of each one of the individuals. So what can we do about it? I mean, obviously you can always say, because they don't go to a doctor. I mean, I know minorities, they don't go to doctors, and they don't like. Why they don't go? I mean, there is a barrier with languages. They don't trust the system. Another question is, how many doctors of color do we have in the community to begin with? How can you trust somebody that does not share, or doesn't have to share, actually? We just need to respect your culture. We just need to just be a good listeners. We just need to just take your story into consideration. But more than your story, consider you as a human being who needs our help. If we start breaking these little, fences, and start opening ourselves, we physicians, we healthcare workers, and to start kind of, forgetting about these preconceived ideas or misconceptions that we have about people, and that has something to do, a lot to do with racism, and with bias. We are living in an era where we can go back and forth to the moon. I mean, as easy as that. We are doing, teleconferences. We're using really smart devices. We're advancing technology like crazy. Like I sometimes don't understand how this stuff works myself. It's like, wow, this is cool. I didn't know that. But we are still seeing people out there who just, as talking about this with you a few days ago, we'll still have people out there who think how minorities can be doctors. That's worrisome. We are living in a society where the disparities are clear now more than ever, are affecting us all. So I don't want to get into political issues or nothing. This is just basic public health, basic science, and this is basic humanism. And this is just I was just reflecting myself, in the last few days. What can we do about this? And I think there is so many things that we can do about this. But we need to start with ourselves. So we need to start with our families. We need to start, besides, raising our voices, raising our concerns. We need to start in our families with our kids, sharing cultural heritage, telling how proud they should be of who they are. We have to start getting ready the new generation of professionals, especially in the US, I think worldwide, but we're talking about the US. We need to start really being intentional about diversity, being intentional about representing minorities in the medical profession, in the health profession in general, representing minorities in the educational systems. I was so happy when I just learned a couple of days ago that the new director of the University of California is the first person of color in the history of the university. 152 years. And this doctor, president now. It really makes me proud. But we have to believe on it. So you have to believe, no matter who you are, how your face look like, how the color of your skin is, you have to start this at home. We don't need to be always victims of the situation. We have to embrace the change, but we have to get ready for that too. So we have to start telling our kids at home, on the table, hey, you're special. You are special. You are bicultural. You are special for who you are as a human being. So you don't judge this person because it may look like and there's some Latinos that they don't look like Latinos, and there are some people of color you can get really full. I mean, easily. Has happened to me. I was like, oh whoa, but we need to start breaking that. But they need to start from home, because there is one component here is education. So we need to start investing on education, and that comes from home. So the new generation of professionals, that is, for me, from my humble standpoint, is the #1 place that we have to start our change. So we can get ready for the new generation of people, open-minded people who know ideas, people who can consider diversity and inclusion a vital, step in every organization. Now we heard, in Michigan, they're doing this training, like implicit bias training for all medical professionals. So you gotta get a license in Michigan, you gotta get this training now. So I'm so happy for that. Different institutions, in Boston, the Boston Medical Center, they have a, diversity program as well, an amazing place. We gotta follow this lead. We gotta follow these people who are starting to make a change, which is important. Again, this obviously it comes from home. We need to get the people. We need to have the talent within the minorities. But this is just not about minorities. This is about being inclusive and having a diversity, in the workplace, having a tolerance. And so making health and policy changes are extremely important, because at the end of the day, that's going to help us to get a funding to help the underserved, to, kind of focus on the vulnerable communities. Now, the Department of Health and Human Services in North Carolina just announced a couple of days ago, they're gonna, set up 300 places for testing for COVID-19, which is awesome, just for vulnerable communities. Now, we have the tools, but then you need to make the connection. What's gonna happen with those people who are gonna get tested? Are they gonna be seen by the doctor? We here in the clinic, we offer testing, but then you ask the question, do they have transportation for people to come here, and get tested? Do they have the time to miss from work? We're talking about that kind of population. On the one side, I had a patient very upset because, his test was not ready after 4 or 5 days. He was really, when the other side is somebody else who said, please, I need my answer because I need to work. I need to provide for my family. Two whole different situations. Again, this COVID-19 doesn't have any kind of discrimination in place. It affects everybody, every social status, but we're getting really, hit hard on what is minorities and vulnerable communities because of all these reasons. Before I keep going, any thoughts about this, Ed? How you feel about this?
I think you're providing us some great information and talking about the disparities and access to healthcare. That is huge. We start talking about the vast majority of the essential workers are minorities, and for some of them, it's hard to take that time off to get tested because they got to put a roof over their head. They got to put food in their stomachs. One of the questions that I have for you personally is if you can talk a little bit about the transmission of COVID. Because there's a lot of information out there, and we hear one thing for like you got to be 6 feet apart, and in other places like make sure you have your mask on. Some places, you're hearing about it's laying on the surface for XYZ amount of time. From the medical field in your profession and your expertise, what are you seeing is the way that it's being transmitted the most?
Good. Yeah, that's basic question, important actually, is just through close contact with others, as simple as that. So it is not just to be in close contact with other people. It's usually the time that you spend with people who is less than 6 feet away. People said 10, 15 minutes at least close to these people who has been carriers of the disease. Carriers mean that they don't have the symptoms, but they have the virus. So you may be talking to somebody that feels completely fine, but if you don't have the protection, they, can get a disease to you. Now, don't talk about medications because there's a lot of research still going on there. There is not a final answer, but on terms of how you can prevent this, yes, keep your distance, use your mask, wash your hands. Going back to the basics, that's the way how it's transmitted. Let's gonna, dig a little bit deeper into this. There is some people studying where are the places where you have the highest chances of contracting the disease, and actually two main ones. So one is restaurants and two churches. So in churches, I don't think many churches are open now because these people, why? Is that the reasoning behind this is places that are closed and where the AC unit is moving the air around, and you are in a table eating on a restaurant, and then another table is near, close to you. I mean, there is a high chance that you can, have the disease because of the circulating, the air. Obviously, I don't want to ruin the restaurant business now, but I just gonna make, we're aware of the situation. I know restaurants are trying to open the patios, and that's fine. You can keep some distance from each other, that's okay. But whenever you're in a closed space for a long time, or wherever you're talking to somebody else with no mask, and especially the people, is interesting enough. They said, one study said that when you're speaking loud, I'm glad that I'm speaking in front of the computer right now, because then you spit all those droplets, and then the virus goes, there. So, but those are the most common ways of transmission.
So I have another question for you. It's very controversial right now, and I personally don't understand it, but you have a segment of the population that refuses to wear a mask. What are your thoughts on that?
Yes, there is always, people who are gonna, try to make their own decisions. And again, the reality is that if you have one people, or you have, two people talking, nobody's using a mask, the transmission rate is very high. You have one people with a mask, the other without a mask, still the transmission can be high, not as high. If you have two people with a mask, the transmission goes very low. So why people are out there gathering and still, especially when you're in a kind of a more than just a couple of minutes out there, but just talking to others in groups and then not using a mask, I don't really understand that situation either. But it's so important to your health, or the health of the community depends on what you do. So
So what I want to do now is I want to open it up for questions for some of our attendees. And we just had one question. So to ask a question, if you just hover over the middle of your screen, there's a raise your hand. If you raise your hand, we can take your question. But I had somebody drop a question in the chat, and their question was, how bad or deadly do you think that the second strand of COVID that they're predicting will be?
Great question. Great question. I don't want to give any predictions on numbers because I don't know, and it's difficult to make prediction when everything is going now. It can be severe if we don't contain what's going on right now. So we see now in the U.S. In the Sun Belt, you see Arizona, and even states like Florida, Texas, the infection rates and the death rates in the last 3 days has been the highest so far. Compared to when the disease began. What's going to happen in the fall and early winter? We're going to have the weather changes. Usually immune system is going to be decreased. We're going to have the flu or the regular viruses coming in. That is going to could create kind of the perfect storm for a kind of a raise of cases of COVID. And what we have been seeing, there is some studies showing that there is at least 4 to 5 mutations of the virus. So COVID-19 can be changing and changes quickly. what do you think that initially the virus was affecting mostly people over the age of 70, 75. Now, another interesting fact, North Carolina, the people has been mostly affected by COVID is actually the younger population between ages of 15, 18 to 45 or 50. So we have the middle, bracket of the population having the most infections on the state, talking about North Carolina. So it's concerning. To finalize my answer, I will say it could be severe. What's going to happen in the winter? I think it's going to depend on a couple of factors. One is how much can we contain what's going on right now. We can do our part and try to reduce the chances of keep spreading the condition before Mother Nature start working on the weather and then other viruses coming on. So, but it's difficult to predict.
Okay. Looks like Florida, you have a question?
Yes. So my question is, with the second strand that is being predicted and you elaborating more on the second strand and how it's a deadly combination to society as a whole, would it be wise for schools, universities to stay on virtual learning versus in person?
Oh, okay, thank you, Florida. I knew this question was coming. Oh my goodness, I knew this question was coming. Is that hot question?
Yeah, I have kids in school, in college, in high school, and some people are saying that they're gonna go back to the classroom setting. But with me being a parent and knowing how deadly this virus is, I would opt out to doing homeschooling versus them going into the classroom setting due to the virus.
Yeah. So thank you. And for asking, there is always a balance in life in general. So there are always the pros and the cons. When you see, we still need to get probably more data how things are going to turn in the next 4 to 6 weeks. There is so far like 3 ways to go. One way is let's not completely open schools. The kids need to be back to school because that can also affect, your parents. They need to be, back to work because it's challenging. The second group of people will say, let's do 50-50. Let's be more cautious. Let's send some people back to school. Let's keep some social distancing. Let's keep the mask on. Or let's gonna, yes, the third group of people, let's say, yes, do everything from home. If you ask me personally, I will probably stay between 2 and 3. So I think that completely fully open schools is gonna be a little bit risky. Again, my humble personal opinion, because of how the trends are going right now in the country. It can be a little bit too ambitious. If we, on the other side, we take a little bit cautious approach in terms of we can, keep some distancing back, depending on the school size and different factors, and giving still the option to do online probably is not going to be a bad idea, because at the same time we need to keep into account that the families need to go back to work. No, you ask yourself, I mean, are they really going to go back to work, or things are going to be still shut down? So, and then on the other side, doing everything online is obviously the safest option, but at the same time, how much education is going to be affected for these kids, I think they're going to be okay. But again, sorry that I don't have a clear answer, but because I'm still thinking about that options too. Those, well, for me will be probably between the second and the third. I don't personally think that it's going to be a good idea to completely open schools fully, because it is difficult. I mean, it is difficult to control this behavior in adults like ourselves. Imagine for little kids. I mean, they are, they are kids. I mean, they just, don't want to probably follow, match instructions in general. Being nice with them.
Well, that was good commentary. So, anyone else have any questions? We have the Dr. Cornelio on the line, and this is a great time to, have him answer some of your questions. So,
yeah, Ed, I'm sorry if you don't mind us, because I know we haven't talked much about stress and resilience. So we talk about pretty much the COVID and what's going on right now. But I think when you see somebody talking about resilience and stress and COVID. That sounds cool, but it is actually cool to talk about because, you know, stress is probably the factor number one to affect disease and mortality in the US, in the world. You know, stress, depending what you mean by stress, can affect from your, you know, your heart health, your immune system, and everything in between. When you have a situation like this, the COVID-19, and then you have two options. I mean, you just actually resist the change. You say, no, this is not real. I hate it. That's not. Or you can just embrace the change. Embracing the change is what we call resilience. So resilience is just how can you be successful, you know, facing an adversity? How can you be successful in life when something really tragic, traumatic happens to you? And I think that is something that we need to focus on right now. And there is a, you know, a common trend, interesting enough, vulnerable communities, minorities, you know, historically have been so resilient.
Yes, yes.
We have, why? Because, I mean, there was no other way. I mean, there's no other way. I mean, you go to a place, you get used to the situation, you gotta just embrace the change. I mean, that is my first concept of this talk today was the health of the community depends on the health of each one of us. And the second, I mean, take home message will be embrace the change. It is always easy to say than to do it. And it's not simple, especially for us, healthcare workers, you know, putting a smile on our face in the middle of, you know, patients and then phone calls and, you know, drive-throughs and then people asking you so many questions. But we have to just, you know, change how you practice. You need to change, you know, your communication skills. I mean, if a doctor tells me, oh, I'm not used to computers, forget about that. I'm sorry, you have to do it now. I mean, we are doing a lot of telehealth. We're still seeing patients in the clinic, but we're trying to embrace the change. We need to see that, you know, tough situations in life are the ones that make you grow. Simple. When everything is smooth, you can have a happy life. I mean, but can be boring, you know. When you have a tough situation like a crisis, like we're going right now, these crises, you know, usually show up the best and worst of people. So go for the best. So have every day the best day you can have. You know, try to show the best you can be. And as I told, you know, told my kids, I told the kids of my patients, my own patients, you have to do your best, not because you are a minority. You have to do your best, not because you are Black or you know, a Hispanic kid. You have to do your best because that is the best that you can do. You gotta show the world, you know, how, you know, the gift that you have, because that's the right thing to do. And I think if we're gonna kind of always, you know, delve ourselves into, you know, I'm Hispanic, I wanna show how a Hispanic can go, which is cool, you can do that. But I think if you do, I wanna do my best because I wanna be the best doctor that I can be. You know, I wanna be the best listener that I can be. I wanna be the best friend that I can be, or the best dad. So I wanna be always your best. And that is actually in situations of stress. And you know, you have your mindset and your purpose in life. You know, good news for everybody, as you know, resilience is nothing that you are born with. People can say, I'm not resilient. That's for people who can adapt. No, I'm sorry. Let me correct you. You know, resilience, you can cultivate resilience, and your resilience actually change along, you know, the years in your life, depending on the situations. How can you be more resilient? Again, is embracing the change, being open to communicate to others, accepting that you are different, and being optimistic, and having a purpose in life. If you ask me what all of the above are the most important for me, I think having a purpose in life. If you have a purpose in life, like you're doing something good for others, you're in a good place. You're gonna be successful. You're gonna be okay. But again, it's having a purpose in life. Whatever you do, I mean, you're connecting people in the community, and you do an amazing job. I have a lot of respect for what you do in the community. And how can you put together, you know, hundreds of people in a room or at least used to before the pandemic. But and that is amazing how we can, you know, connect diverse people with diverse backgrounds, and then, you know, make sure, you know, how can you make other people feel is more important than the prescription that you can make. And I think that is how you create, and this is, I don't want to be philosophical, but being kind to others, kindness, you know, showing compassion. Those are, and just being grateful that you're still here. So being grateful, being compassionate, and showing kindness to others is going to let you cultivate these values that, again, we need to share those more among our minority, you know, and kids and everybody else. But, and that is, I think, again, I don't want to go that far out on that sense, but I think that is important to talk about stress. And if you have, any of you who are listening now has a family, please, who is working in healthcare or who is an essential worker, please do just one favor for me. If you can do it, just give them a call and ask them how they're doing. Yes, give them a call, not to ask them, hey, what is the latest treatment for, you know, is this ivermectin working or hydro or whatever? Just give them a call. I'm sure you out there, you have family, you know, nurses, you know, medical assistants, you know, doctors, you know, firefighters, whatever. Just call them and say, how are you doing? That means a lot. That means a lot to us.
So, you know, you kind of stole my thunder there, because I was really about to ask you, how are you doing mentally, emotionally, and the team over at Advanced Care during this whole pandemic?
Thank you. I cannot tell you, it is tough. I mean, it is obviously, it is challenging. We just had a meeting today with my team. We just closed the clinic literally for 2 hours. I mean, we never close, but we need to take this break. I'm so grateful that I have an amazing team here in the clinic, and you know them. Yeah. These people here, if you ever visit our clinic, if we are honored to have you as our patient, these people here go above and beyond. You have no idea what happened behind the scenes. You have no idea when we have, you know, 10 people calling, I need to get my results, please, and then, which is completely fine. We try to do our best, but at the same time, we're kind of have some limitations, especially right now, in terms of turnaround times for testing to be back. It's getting longer and longer. So we try to do our best. I mean, you know, it's exhausting. So I remind them, all of them, I remind myself that, I mean, I'm taking my breaks always, you know, trying to exercise, trying to, you know, do my walks. I need to first take care of myself so I can be in good shape to help others. That's been my motto, you know, along my career. You know, I mean, when I'm not doing that, I just don't feel tuned. And I think that's so important. I tell all my staff, hey guys, when you are not here, please don't even show up. My providers, when you are not here, please don't check your staff. Just be with your family. You know, I want to see you running, you know, biking out there. Just don't be here, because when you're here, you're going to be busy. Now, more than ever, I pay myself more attention to my ways to reduce stress and maintain my mental and emotional well-being. And so far, it's working great.
That's great. So with that being said, is there anyone else out there that has any questions they'd like to ask the doc or make some comments? We'd love to hear from you. We see quite a few people out there. We wanted to have this be very conversational. And, you know, the doc's affording us some of his time where he could be out there, you know, working with some patients. So I'll give everybody a couple minutes to chime in if they have any questions. And just while you guys are thinking about your questions, like I said, this is the best doctor in the triangle by far. And yes, I'm being a little biased because he is a Patriots fan too.
There we go. Not many people like the Patriots here, by the way. But,
hey, that's okay. You know, we'll take it all on. So it it doesn't look like we have any questions, and I want to be very respectful of your time. How can somebody said literally he is the best, and I don't like the pets. That's okay. That's okay. We still like you anyway. Is how can people find you?
Yeah, so thank you. We're here in Advanced Care Durham. You can just put my information, phone number. We are here in MLK Boulevard and University. So easy to find here in Durham area. We are being glad to have patients from many places in the neighborhood, in the triangle, but also we are have the capacity to see patients across the US. So we have patients from New York to Florida. So we're because of telehealth. But I gonna put my information. I'm gonna put my Facebook site as well, so you can have all my information there, phone number, and anyways, book your appointment. We're always taking patients, but we're looking, trying to work in collaboration and try to be there for you when you need us. But yeah, so thank you so much, Ed, for the time. I really had a good time, talking to you. I always appreciate the that I will say. Not many people have that skill that you have to put so many, brains together, and especially inspire the community. So I think what you're doing is encouraging. I mean, you're trying to make connections in the community, which is vital. And I do appreciate, of your work. I just want to leave everybody with this reflection about, who we are, what can we do from ourselves inside out, and how we can create awareness wherever you are. Again, you don't have to be a doctor to reduce disparities and to increase resilience in times of stress. But anyways, have a wonderful weekend, and thank you so much for having me.
Yeah. So Doc, we definitely appreciate you. We're thankful and we value everything that you're doing out there in the community. On behalf of the community, we love you. I just got to give another plug to my doctor. He picked up the phone, and I think it was last Thursday. He just picked up the phone to call to check on me and my family to see how we're doing. And I don't know how many doctors actually still do things like that. But he's one of those doctors that will do things like that. So that's why my family and I, we absolutely love you. That's why we stay patient with the last couple of years. I think when you were first opening up the shop, and my wife is running over here to wave to you as well.
We love you.
Yeah. Oh, you're Florida too. Thank you.
Yeah, but you're amazing. I thank everyone for taking time out of their day to just jump on and just hear from Dr. Cornelio, just share a little bit about what's going on with COVID as it relates really to the minority community. So once again, for those of you who I don't know, my name is Ed Dudley. I'm the founder of We Are Connected. Feel free to follow us on Facebook, Instagram, and LinkedIn, because we do connected conversations like this and some other ones, just talking to people in the community and find out what they're doing and just hopefully add a little value to, everybody's life out there. So I appreciate all of you. Definitely, Doc, we appreciate you and the whole team. Tell the whole team over there that I said hello. This has been another connected conversation. You guys have an amazing weekend, and I'm in Mississippi, so hopefully y'all are a little cooler than I am right now. All right, everybody have a great day. Take care.
Everybody, thank you. Bye-bye.